Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is December 4th, 2020. As always, we start with our COVID-19 statistics. Worldwide, we have over 66 million cases and over 1.5 million deaths. In the United States, we have nearly 15 million cases and nearly 285,000 deaths. If current death rates stay the same, we'll have more U.S. deaths with COVID-19 than U.S. combat deaths from World War II by next week. Deaths from COVID-19 have nearly reached 3,000 a day. That's the same number of deaths as was caused by the terrorist attacks on 9/11. No matter the cause, it's always sad to see so many deaths, but what is especially tragic about these deaths with COVID-19 is that the deaths we're seeing now, in contrast to those with 9/11, are not uniting us. We are still so divided. Due to so many people ignoring CDC guidelines for Thanksgiving, we're expecting to see a surge in cases as early as this weekend. In fact, we're already seeing a slight increase, even today and yesterday, but we expect it to become more obvious in the next few days. Hospitalizations and deaths will likely surge next week and the week after as the cases start to turn into hospitalizations and deaths. We understand the reasons that people don't follow guidelines, and we're sure that most who don't follow the guidelines truly believe that their reasons are valid. But honestly, none of those reasons make any sense when we compare them to the deaths, long-term health issues, and even economic problems that are caused directly by COVID-19. And that's not even taking into consideration the side effects of trying to fix COVID-19 or cure it. As we pointed out the last couple of weeks, if everyone would just wear a face mask and follow the other guidelines, we'd be able to avoid lockdowns and closures, and the economy would actually be able to recover. Those who stubbornly refuse to wear face masks are actually doing more harm to the country, to our country. They're harming it basically in the ways that they're saying that wearing face masks will harm it, the economy, etc. Anyways, let's move on to more news. This past week, AstraZeneca's vaccine results were brought into question. We mentioned last week that they'd had some decent results, especially if they have a smaller dose first and then a larger dose. This week, though, the results were looked at, and a lot of scientists are concerned about those results just because there were some irregularities in the testing, the way that they got the results. They combined a couple of different studies instead of just having one overall study. So this means that they may need to do more testing before they're going to get approval. That's not for certain, but that it looks like that may be happening. So we may be limited to just the two main vaccines from Moderna and Pfizer for the first little bit here. Speaking of vaccines, the CD released guidelines for who should get the vaccine first. These are only recommendations, and states are free to choose their own priorities, but most states are likely to have similar guidelines to what the CDC suggests. The first two categories of people that will get the vaccine are those in nursing homes or other long-term care facilities, and healthcare workers. Based on the estimated number of doses available by the beginning of the year, there will be some in these first two categories that will not get the vaccine by January. They may not even get it until around the beginning or middle of February. The next group to get the vaccine would be essential workers. This is a huge group that would include teachers, grocery store workers, police officers, public transit workers, and others whose jobs make it hard or even impossible to work from home. After that, adults who are at a higher risk of severe symptoms or death from COVID-19 would get the vaccine. This would include those over 65 years old and those with certain medical conditions. Based on the current estimates of when vaccine doses will be available, it's likely that these higher risk groups won't be fully vaccinated until April or May of 2021. At that point, others who didn't fit into any of the previous groups will then be able to get the vaccine. Just to reiterate, though, the actual distribution of the vaccines will be handled by each state. So there may be some changes to these CDC guidelines. We don't expect huge changes, but some small changes. One example is that quite a few states have actually indicated that though they will follow the majority of the guidelines, they may split the last priority phase in two. with the first part being those with medical conditions or over 75, not 65, like the original CDC guidelines say. And then the second part of that would include those over 65, so between 65 to 75 basically at that point. The CDC also followed through with their plans to change the quarantine guidelines. They still recommend a 14-day quarantine, but they have stated that if you're not showing any symptoms, you can stop quarantining after 10 days. If you get a negative test result, then you can stop after 7 days. A new study by the CDC has found that the virus that causes COVID-19 was in the United States as early as December. They tested blood samples collected in 9 different states between December 13, 2019 and January 17, 2020. They found COVID-19 antibodies in blood samples collected from California, Oregon, and Washington as early as December 13th. Other states showed COVID antibodies in early January. Because the West Coast states showed COVID-19 was there at the earliest point the study tested, it's likely that testing blood samples from even earlier in December or possibly even November would also show COVID-19. The first confirmed cases in Wuhan, China didn't happen until late December 2019. These findings probably mean that there were earlier cases in China that were just never confirmed as COVID-19. In fact, some previous studies suggest that it may have been present in Wuhan as early as October 2019, though we have not been able to confirm that research. There's also the possibility, however, even though it's a remote possibility, but there is a possibility that COVID-19 didn't even originate in China. It'll take a lot more research to get to the bottom of this mystery. Also, a note on that study, some people have said that you may get those antibodies from getting other coronaviruses, such as those for the common cold, etc. This study was very thorough. They went through and they eliminated any possibility of that being the case. So these were definitely COVID-19 antibodies. New information from CDC research shows that over 50% of all COVID-19 infections happen because of those who don't show any symptoms, meaning asymptomatic, or those who aren't yet showing symptoms but will later, called pre-symptomatic. That is exactly why it's so important to wear a mask when you go out, even if you don't feel sick, and even if you're not worried about getting sick. Anyone could have COVID-19 and be spreading it even if you don't show symptoms, so everyone should wear a face mask. This past week, Dr. Fauci basically said what we said a couple weeks ago about closing things down. He mentioned that as much as possible we need to keep schools open, but the places that need to close are the bars and similar establishments because that's where the spread occurs. He specifically said that the best way to ensure the safety of children in school is to get the community level of spread low. In other words, we shouldn't focus so much on the children, we should focus on ourselves and our own actions and what we're going to do ourselves to make sure that the community spread doesn't go out of control. So, I'd like to give another reminder of exactly what we need to be doing. 1, wear a face mask over your nose and mouth anytime you're out in public and can't keep at least 6 feet between you and anyone not of your household. If you're in public inside a building or a vehicle, you should be wearing a mask regardless, because even 6 feet may not be enough if you don't have good enough circulation of the air. N95 masks without vents are the most effective, but they are in short supply, so we need to leave those for the healthcare workers. Don't buy any new ones. If you have ones already, go ahead and use them, but just don't try and buy any new ones. Leave those for the healthcare workers. Cloth masks are typically sufficient, but make sure they have at least 2 layers of fabric. 3 is even better. Surgical masks are probably the best option of all, just because they fit in that sweet spot. They're readily available, they're more effective than cloth masks, and they're not terribly expensive either. The only real downside to surgical masks is that they're disposable instead of washable, and so it does create more waste, and over time, you may end up spending more that way, more than you would on a cloth mask, for example. Even though cloth masks, you should still be replacing them every now and then, just because they do wear out. Even though you can wash them, over time they will wear out. So 2, second step here, Keep at least 6 feet away from others and avoid large groups, especially inside buildings and vehicles. 3. Wash or sanitize your hands regularly. If everyone were to do these things, our case numbers would plummet, which would then cause our hospitalization and death numbers to also drop. Now, you'll realize I didn't say to just stay inside and do nothing. That's not realistic for most people, and even if it was realistic, it can definitely hurt our mental and emotional health. So we don't recommend just staying inside and not doing anything. Get outside when you can. If you're going for a walk or a jog in an area where there aren't that many people, you probably don't even have to wear a mask. If grocery delivery works for you, by all means do it, but don't make that stop you from going out and doing some shopping in the actual stores. Just wear a mask, try to keep your distance from others, and limit the amount spent in small buildings or poorly ventilated buildings also. If you want to eat out, get it to go. Definitely don't go inside a bar or restaurant to eat. You could go inside temporarily just to pick it up, but make sure you're still wearing your mask and everything, staying away from people. Don't spend much time, but definitely do not eat inside of a bar or restaurant. But go through the drive-thru, curbside pickup, all sorts of different options there. Definitely want to support our local businesses. We're trying to help the economy keep going, but still stop COVID-19. These guidelines that the CDC has been releasing for us have always been about making good choices. It's not about living in fear. In fact, if everyone follows the guidelines, we can have more confidence in our health and our safety. So thank you for watching the Plain English Public Health Weekly Report for December 4th, 2020. As always, we have links below the video to go into more detail about the stuff we talked about and also touch on things that we didn't get a chance to talk about today. I'm Richard Greenland, and you have a healthy weekend.